afternoon. I'm talking to Dr. Richard Shaffer, a clinical oncologist who treats patients with Dupuytren and Lederhoos by using radiotherapy. Richard, can you tell me, does radiotherapy cause any systemic effects if you use it for Dupuytren or Lederhoos?
So, as we know, radiotherapy does cause some effects on the area that you treat. So if you're treating the hands or the feet, then you would expect the palm or the sole mainly to become a little bit red and sore, perhaps a bit dry. You might get some roughness and other skin changes in the long term. And there is also this very small theoretical risk of a radiation-induced cancer in the area that is a very, very low risk, but that really is a subject for another time. But coming on to your question, in terms of systemic effects, well, one thing that I will say is that sometimes people say that radiation can make them tired. Generally, that's associated with treating large parts of people's bodies and not really treating extremities such as the hands or feet. So in most people, I would say most people don't find they feel tired, but I do have some people who say that. But in terms of other effects, just things to understand is radiation doesn't travel to the rest of the body. It doesn't give you a chance of having a cancer in the rest of the body. So, for instance, it doesn't give you a chance of leukemia because there's no bone marrow in the in the fingers and the toes and so on. It doesn't give you a chance of other cancers, for instance, liver cancer, prostate cancer, brain tumors, any of that. So, risk of cancer, no. I wouldn't expect it to affect your immune system, and I really, you're not going to lose your hair. So in terms of, the side effects that you would expect to experience, apart from some mild tiredness, I would expect all the side effects to be local. In other words, only affecting the area that we're actually treating.
That's great. Thank you.